And there are many questions about how Ontario will distribute the vaccines and who is in line after long-term care residents and frontline healthcare workers. But for the second day in a row, the Premier did not hold his weekday news conference. In fact, his office confirmed to me those daily updates that began at the start of the pandemic are over and will only be held when they have a substantial announcement.
I would ask, use your inside voice.
Now, this comes as the legislature rose yesterday for the holiday break. It won't resume until mid-February. The opposition says that is unacceptable in the middle of a pandemic.
To do right by Ontarians, Mr. Ford should be calling the legislature back in January and be facing facing the questions and providing the information.
As for the vaccines, the province believes it will receive about 100,000 Pfizer doses overall, and a small portion of them should arrive next week. It could be April before the general population starts receiving them after high-risk groups are immunized first. Now, if the Premier had held a news conference today, I would have asked him about our exclusive story yesterday that found a Whitby long-term care home had not been following proper PPE protocols, and widespread failures caused actual harm to residents. "96% of residents at Sunnycrest Nursing Home have tested positive. 19 have died. An inspection done when the outbreak began about 2 weeks ago found no one was screened upon entry. PPE was not put on or taken off properly, and staffing was down to less than 50%, jeopardizing resident care. 67 staff have also tested positive. Whitby's deputy mayor wants an investigation.
I want to call on the provincial government to do an inquiry into this nursing home to see why this was able to happen, how this was able to happen, especially in the second wave of this pandemic.
In October, the Ford government made it harder for families to sue long-term care homes. It raised the bar to prove gross negligence had to be met, but it also makes it harder to get a class action lawsuit certified to move it forward in the courts. And the commission investigating the more than 2,000 deaths in long-term care made urgent interim recommendations in October, which included increased staffing, improved infection prevention, and control measures.